My name is Daniela Zanotti. I'm a consultant upper GI and general surgeon, currently working between Nottingham University Hospitals Trust and United Lincolnshire Hospital Trust. I always wanted to be a surgeon since I was very little, like 5, 6 years old. I guess it's because I always wanted to be useful to people in need. That's my main thing in life. So upper GI, which is esophagogastric surgery, it's something I got my interested very early during my surgical training. I believe it's because I've been exposed to this type of surgery quite often during that period, and I really liked the anatomy and the challenges that this type of operation gives. So I started very early to take this special interest in upper GI. The most rewarding thing is hearing patients that are happy and grateful for the service that they have been offered. Happy after the consultation because they have a more clear idea of what is going on, of their condition, of what is the treatment plan or the plan for future investigation, but also happy after the operation when they find themselves that they are pain-free or that the quality of life is improved. And because, this ultimately is what we want the patients to be happy and to fully understand what we are telling them. So in the various feedback that I have received from my patient, the common thing that almost everyone have always mentioned was how clearly and simple I was explaining them everything, and my kindness. So these are the common theme of the feedback I've received from my patient. What I value most from them is their trust. And in order to earn it, I always go above and beyond my duties in order to provide excellent care and good outcomes. I don't know if it could be considered as a mantra or a catchphrase, but my first priority is do no harm, which is the Hippocrates oath. This is because I would never suggest any kind of treatment or investigation if I'm not sure that this will benefit the patient and will not cause them harm.